Welcome to Reid Presents Connect to Develop, where we provide insight from healthcare leaders on the hottest topics and trends. Well, listeners, I'm excited to introduce you to Dr. Wendy Wong, Arthroplasty Director at the Sequoia Surgical Pavilion, Director of Joint Replacement at John Muir Health, and Vice Chair of the Department of Orthopedic Surgery at John Muir Walnut Creek. And we're going to be discussing what having it all looks like. Surgeon, wife, mom, and friend. Hi, Wendy.
Hi, Marney. Hello, everyone. Thank you for having me.
Can't wait for this. Okay, to level set for our listeners so they truly understand what superheroes, such as yourself and other working mothers are, especially physician mothers, can you walk us through what a typical week looks like for you?
Sure, Marney, this is actually a very timely question. So recently, this year, I decided to make a 4-day work week happen for myself. So I'm in my 9th year in private practice, and I finally decided I'm going to make this happen. So basically, I cram everything I can do clinically into 4 days, Monday through Thursday. So I have 2 days of clinic and 2 days of surgeries. And typically on a work day, I get up around 5. I get my kids' school and sports activity stuff all ready for the day so that people can just come and grab their stuff. And I do some work in the morning. Then I'm usually off to work around 6:30 or 7, depends on the day. And then work. And I'm usually home between 6 to 7. So we do try to have dinner as a family every night if possible. Some days, if we have an add-on case, I know that that's not possible. And same with my husband. But we do try. That's the time that we know is family. And some days I do try to end my day a little earlier. For example, if my kids have an important game or something like that, then I can adjust my schedule. And then after dinner, it's, catching up on homework, whatever you got to do for the next day, and then bedtime routine. Then I put sometimes we put our kids to bed. And then after that, I either work again or my husband and I actually get to hang out for a little bit before bed. And I would say Friday is my quote off day. And I usually schedule meetings or I do work from home. I try to spend some time with my 2-year-old who's not at school yet. So I want to treasure that time with him. And then some Fridays I'm able to volunteer at my kids' school, which is really, really exciting.
So I'm exhausted just listening to that. I'm going to go take a nap real quick. Just pause there. I'll be back in about 4 hours. Wow, that is a lot. So what kind of stuff do you do when you volunteer for the school, and how old are those ones?
Yeah, I have 3 kids that are in school. They're 9, 6, and 6. So I have a going to 4th grader, and then my twins are going to 1st grade. And this is something I just started doing this year. I get to do, activities in school for them, reading time or art projects, or sometimes they have chapel on Fridays, and I get to volunteer and be like the chapel mom, which is really exciting. I've never done this before in my life. So this has been a new experience for all of us.
That's awesome. So I will say, as someone who does not have kids, I have a nephew who I adore more than life, and I have a niece on the way. I'm excited. It was funny. The first time around, I was told I wasn't allowed to visit until a full month after the baby was born. And now it's, come on whenever. For those of us who don't have children, it takes either staying in the same house with parents who have little kids for several days or being, friends with a working mom to truly understand how much you have on your plate and how much you're managing. And so once again, major kudos and hats off to all of the working parents, especially for the dads who participate as much, hopefully, as their wives in the care of their kids. So let's jump now back to 2012 when Anne Marie Slaughter, CEO of New America and bestselling author, stirred up a hornet's nest of opinions with an article she published in The Atlantic titled "Why Women Still Can't Have It All." And basically, she talked about the challenges a high-profile, driven, and successful woman faces when also trying to maintain a close-knit, healthy family dynamic. I'll be honest, at the time, I was running a blog called Stilettos on the Glass Ceiling. I myself got really fired up because at that point, I thought maybe I still would have children. But now that I've spent time with working mothers and I really see, you just listed off from 5 a.m. and I bet you're probably not actually falling asleep until around 10:30 or 11. What you cram in, I think I understand this sentiment. So can you tell us about what that concept of having it all means to you
Yeah. And I think that I do have it all right now. I feel very fortunate in the position that I'm in right now. And obviously, I have to thank a lot of people along the way for that. But I think it's all about your perspective, right? Like having it all is different to different people, and it depends on what's important to you. And for me, I want to be a good mom. I want to be a good wife. I want to be a really good surgeon at work, and I want to be a good friend to my friends, my peers. And I think that I'm able to do all that, and that's what's important to me. And I feel like if you're able to achieve happiness and you feel satisfied in the different areas of your life, like your family, your work life, and your social life, then you do have it all. And life is great.
I love that perspective, especially to the concept of feeling satisfied. You didn't say being perfect or nailing it. So that must come. Did you work on giving yourself grace? Because I've seen your profile, I've seen your training. There's no way you're not a perfectionist. How do you, and what advice do you have to other working mothers out there, create that grace and not expect perfection in every single aspect?
Yeah, it's hard because I think a lot of us that have career and being a mom, we're all kind of type A. So it's hard to not be like the best at what you do, the best at everything. But that's not possible. I think you just have to say, I am good at this and I'm able to get a balance in everything that is important to me in life. And it's okay. Like, it's okay to ask for help. It's okay to delegate. And, it's okay to not do everything and control every aspect of your life. It's okay.
That's I'm gonna have to record this and just listen it over and over and over again on certain days. And I don't even have little ones to try to, keep alive and moving on the right track. What is the biggest misnomer that people may or may not have about an orthopedic surgeon mother that you'd like to address?
Yeah, I think a lot of people that hear, oh man, you're an orthopedic surgeon, you have a mom of four, you must be superhuman, or it's not possible to do that, or are you working part time, or you must not be good at either of those things. And so I feel like that I am a good mom and I am a good surgeon. So it is possible. So everyone who's listening out there, it's possible. And you just have to be efficient with your time. You just have to have good social support in place, and you have to be able to figure out what is important to you and focus your attention and your time on those things.
So, what is the most satisfying part of being a patient care provider and simultaneously raising the family? And I have to assume there's some parallels there.
Yes. And of course, the most satisfying part of my job as a surgeon is to see how big of an impact I have on my patients, right? So seeing how much better they get after they get their hip and knee replaced. And it's definitely a life-changing surgery for them. And they are so happy and they can do so much more after their surgery. And so that is definitely why I love my job. And similarly, at home, I mean, as a parent, you have huge impact on your kid's life. And so I try to be a good role model for my kids. I try to make sure that my actions are going to have a good positive influence on my children. Interestingly, one of them did mention that she wants to be a doctor when she grows up. But what made me the happiest was actually when my younger daughter, she told me that she wants to be mommy when she grew up. And that just made my day. I just thought, oh man, she said she wanted to be just like me and be a good mommy. And that just melted my heart.
I talk to a lot of powerhouse mothers like yourself, and I'm in awe of the fact that their children are being raised to see that it's very normal, to the point that you just made. You've got one child that wants to be a doctor. You've got one child that just wants to do as an incredible job as being a mom as you are. And I think it's great that they get to see this as a complete norm. There's not, back when I was growing up, very few women were these powerhouse, professionals. So do you and your rockstar mom colleagues talk about how impactful this is, that you're normalizing that?
Yes, absolutely. All the time. I mean, my closest girlfriend, my best friends are actually my friends from college. And so every one of us have amazing careers, which is really unusual. I mean, my friends are engineers, they're attorneys, they're professors, they're physicists. I mean, it's really awesome. And we all have kids, and our kids are around the same age also. So this is really nice when we get together. And we're definitely all very proud of ourselves and each other. and what we've done. And so I think that it helps that we have our peers to share our struggles with. And our kids, though, I mean, they all see what we do every day, and this is normal for them, and it's normal for us. This is just a new generation, I think.
So what I'm hearing is it's the Mensa advisory board that gets together when you do girl trips. And then second, can I be invited to the next one?
Always welcome.
Look it up. Studies show that while the rate of spouses contributing equally to the family on a financial standpoint, working mothers are still spending more than double the amount of time on housework than their husbands. I'm sure many working mothers out there are going to pause this and play it for their husbands, and I'm going to probably get some hate mail. In fact, 4.6 hours per week for women versus 1.9 hours per week for men. I don't know if they put Apple Watches on them and just clocked it. So how do we reduce the incidence of burnout for working mothers that have all this pressure of a busy and taxing career and then come home and either take on extra household and childcare work on top of the professional workload?
Yeah. And I think most mothers, they don't delegate enough. It's absolutely true. And I have no problem delegating. I mean, at work, I delegate all the time, right? So at home, I do that. So to me, it's about spending quality time with my kids, the most amount of quality time, not just time, right? So I outsource everything that I can possibly outsource. My housekeeper, my nanny, I get groceries delivered, Amazon, meal prep, everything that you don't need to be doing, you should just try to outsource. And I also organize the family schedule. So then I get my nanny involved, my parents, they do a lot of like the day-to-day drop-offs and pickups that are, I don't want to say mundane, but more mundane. And then I make sure that the time that I take off, I'm going to all the important games, I'm going to all the important school events, so that I'm there for all of the big things for my kids. And then I think one thing that a lot of women don't do enough is to involve their husband, right? So men, I feel like a lot of men, this is not all men, okay? I feel like a lot of men, they just need a lot of directions. And it's not going to be a 50-50 load, but if they can do some help, it's better than no help. So for my husband, he follows directions. So I just tell him, hey, can you do this, please? Can you do this, please? For example, he knows it's his job to take out the trash, to empty the diaper genie, to load the dishwasher, and he does all of the doctor's appointment for the kids. So we have an understanding, right? Anything car related is his problem. Anything related to the solar panels is his problem, etc. So moms don't have to do everything at home. You just need to know how to delegate. And I think what's important is the quality time that you spend with the kids, right? Reading the books, actually playing with them, talking to them, and, being there for all of the important things.
I love how you chunked it out into departments. And it brings back memories of, I'll reach out sometimes and ask a surgeon who lives near me about, certain resources, and I'll get a text back that says, I'm sorry, that's not my department, but I can ask my wife if you want. And I really didn't understand the whole department concept, but I get it now. He has clearly been given his department, and that doesn't lie in his department. So what keeps you going on days where cases run late or clinic is just super slammed? And then you also have all of these meetings with all of the administrative leadership roles that you take on, and you're just running low. How do you reset and recharge?
Yeah, that happens. It doesn't happen a lot, but it does happen. Then I pause, right? You have to, and then I remind myself how lucky I am to be where I am, right? Just take a minute and think about how fortunate we all are. I mean, a lot of people that are listening to this, how lucky you are to have, I have a great family. I have 4 healthy children. I have a very understanding husband. I have a booming practice and the skills to do what I do, right? To be able to give people a new hip and a new knee. And this is a privilege. And then I remind myself, all of these people, at work when things are really busy and patients are waiting and they're angry. And then you remind yourself, like these people are waiting 4 to 6 weeks just to talk to you for 10 to 15 minutes. So how privileged you are to be able to offer that. And how much your kids love you. They just want to be with you all day. They want to spend more time with you. And this is such a fleeting moment. And so to really treasure that. And so we have no excuse to complain, basically.
I love that you talk about practicing gratitude as a way that you reset yourself. And I did a podcast with a couple of early career surgeons, and the podcast was really about arrogance versus confidence and the role it plays in patient care. And I asked them, for any tips and whatnot. And one of them, Alex, actually mentioned practicing gratitude. And he thinks that practicing gratitude gives you confidence versus, just simply being arrogant. And so I think it's absolutely incredible that on moments where things are just going haywire, you stop and you think about that there's so many people that maybe couldn't or wouldn't do what you do. And that's how you gain back. I mean, I've never heard that before. It's incredible. So besides the outsourcing, which I absolutely love, can you share any other great life hacks on how you keep all of the balls in the air?
Yeah, I think it's all about time management again, right? And efficiency is really the goal in life. And for work, I try to be really efficient at work and I try to motivate my team. So I tell my team, hey, we want to be getting to a state of flow. Basically, this is where the state of flow is where everybody's doing their part of their job so well that things are seamless and that work becomes fun, basically, and it's very satisfying for everyone involved. And everybody on the team is functioning to the top of their ability. And this is really how I feel every day when I'm in surgery. I mean, it's just so seamless. Everyone's having fun and things are really efficient and you get great outcomes. And then at home, it's about quality time, right? Not just spending time as a family, but also making sure that we have some one-on-one time. So my husband and I, we spend some one-on-one dates with each one of our children. And the quality time that we get to spend in those short amounts a lot of times overpowers the lack of quantity of time that we spend, if that makes sense.
Is there any realistic ability to have a hobby as a very busy career woman, mother, wife, etc.?
Yeah, that's a little hard. It's been challenging. I mean, I would love some time for hobbies, but I do, rarely I get to meet a friend for a yoga session, or like once every 2 years, we'll get a girls trip to go wine tasting, but they're rare. And sometimes I try to incorporate my family into my hobby, right? For example, I'll get my oldest, my 9-year-old, to go on a run with me, and that'll be like some alone time, and I get to go on a run. And then I get my kids involved when I bake. I love to bake. So we'll all make cookies and banana bread and muffins together. And then the kids love it too, right? They think this is so fun. And then I'll get the whole family go on a hike, on a Saturday morning. We'll go on a hike and then we'll walk to Starbucks, little things like that.
This is so cool. So what you don't know is that two of your colleagues way over on the East Coast, doctors Josh Roselle and Vinay Agarwal, all have daughters. And one of the things that they do to bond with their kids and have a hobby is baking. In fact, they've created this thing called, girl dad brownies or such. So I'm going to introduce you at AAOS, and then I actually want a bake off and I will be the judge.
No problem.
So for advice to our listeners out there who are a little bit more early in their career, they're mothers, or they're about to enter, motherhood, you've given some phenomenal pieces of advice. What else can you share with them that they're about to go through on this journey? So as they encounter it, they don't feel like they're alone or like they're failing or like, things are just out of control, and how is everyone else doing it?
Yeah, I would say take control of your life. Just grab it and manage it and go, and just learn how to be very efficient with your time management. I think that would give you the most powerful tool to be successful. And, don't be afraid to ask for help. You can be a great leader and you can ask for help both at work and at home. And of course, just enjoy the journey, right? Enjoy every moment. It's good. It's a wild ride, but it's so fun and it's going to pass by so fast.
Wendy, it's been an absolute pleasure. Thank you again for continuing to pave the way by shattering the glass ceiling, doing it with class and with some great accessories, and proving that you can have it all at the same time.
Thank you, Marney.
Thank you. So listeners, if you want to learn more about Dr. Wendy Wong, please check out her bio in the show note. Thanks for listening to Connect to Develop. You can find more interviews and Marney's Minutes on my YouTube channel at Marney Reid Presents.